When dealing with chronic neck pain or spinal problems, understanding your surgical options is crucial. There are two typical surgical options when dealing with the neck. There is a discectomy and there is a cervical fusion. They're important factors to look at when you're considering both procedures. This video will give you a comprehensive overview of both procedures so that you and your healthcare provider can pick the best option that suits your needs. Hi, my name is Chris Brandt, and I'm a physical therapist here in Birmingham, Alabama. I've been treating patients for over 10 years now, and I see everyone from pre-op patients who are about to have a procedure done to post-op patients. I love creating individualized treatment plans and collaborating with surgeons on the best way for their patients to both be prepared for surgery and to recover from surgery. Today, I want to review with you what a discectomy is, what a fusion is, what the recovery timelines look like, and how physical therapy can help you with that. So the first procedure that we're going to discuss is the cervical fusion. A cervical fusion is when a surgeon goes into your neck and takes typically 2 or more levels of your vertebrae, removes any misplaced disc, any bone spurs, any bony abnormalities, and fuses them together, typically using some type of hardware and a bone graft. A cervical fusion is very common for treating issues like stenosis and disc degeneration and anything else that creates abnormal amounts of instability in your vertebrae. A discectomy aims to relieve pressure on nerves so that it can relieve pain and restore function. During the procedure, a surgeon typically makes a small incision, goes in through the neck, and clips away the part of the disc that is having impact on your nerves. Doing so relieves pressure on the nerve roots and the spinal cord. You'll typically be recommended a discectomy when you have an acute herniated disc that is causing pressure on a nerve root. An important difference between a cervical fusion and a discectomy is the recovery timelines. With a cervical fusion, it can take several months to recover. This includes having to wear a neck brace after you get out of surgery, and then slowly over time regaining range of motion. You're going to be severely limited in the amount of upper body exercise that you're allowed to do, but that will slowly come with time. With a discectomy, recovery can take sometimes just a few weeks. And a lot of times, range of motion isn't limited, just depending on the severity of your disc herniation and how much disc had to be removed. You'll be able to get back to doing whatever it is you want to do much faster with a discectomy than you will with a fusion. Let's talk about how PT can help. In many instances, you may be going to PT prior to having a discectomy or prior to having a cervical fusion. In those pre-op appointments, you'll be mainly working on range of motion. After surgery, both procedures have a very similar stages that you go through with physical therapy, but the timeline that they take can be very different. At the beginning of your PT sessions, we'll mainly start to work on pain management, whether you use ice, whether you use heat, how posture can help, positions that you need to be able to get into to sleep better. The second piece of that is slowly building up your range of motion in your neck so that you can be able to drive and to look behind you. The third piece is going to be strengthening. A lot of times our upper body becomes weaker when we have neck pain or a neck injury or after neck surgery. And so starting to strengthen our arms, strengthen our shoulders, begin to strengthen our neck is going to be an important piece to this recovery. The final piece is going to be education. Although we'll educate you during that whole process, you beginning to be able to do exercises at home with a home exercise program, being able to start to learn what you can and can't do after surgery is going to be vital in you getting back to doing the things that you want to do. The decision to have either a discectomy or a cervical fusion really depends on your condition. Both surgeries have their merits and their own timelines, and both can be very much enhanced with the use of physical therapy. If you would like to learn more about physical therapy, click the link in our description below to watch our video, What is Physical Therapy? This video contains a comprehensive view of what physical therapy can do, what it treats, and how it can help you get back to doing what you love to do.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.